So we come to our final talk of the day. We saved the best for last. Rhona Hewitt, who is going to speak to us about helping to close the gap in living donation access in our community. Rhona.
Good afternoon. I'm going to be discussing helping to close the gap in living kidney donation access in our community. End-stage renal disease places a significant burden on the people of the United States as well as the healthcare systems. The United States renal data systems reported the following data. In 2021, the incidence of ESRD among Black patients was 2.3 times than that of white individuals. The incidence among Native Americans was 2.3 times as high and was twice as high among Hispanics. Also, as per the USRDS, these disparities had been improving until 2018, but they worsened from 2018 to 2021. According to the USRDS, in 2021, the prevalence of ESRD among Black individuals was over 4 times that of white individuals. Also, this prevalence among Hispanics and Native Americans when compared to white individuals was over twice as high. Also, as per the USRDS, compared with Black individuals, there's a higher percentage of white individuals who initiated kidney replacement therapy with peritoneal dialysis. However, the percentage of individuals using peritoneal dialysis was highest among Asians, which was 20%. It was also noted that a higher percentage of white individuals had also received a preemptive kidney transplant, which was 4%. White prevalent ESRD patients had the highest transplant rate, which was 38.4%, and the lowest receiving in-center hemodialysis, 50.2%. Native American patients had the lowest kidney transplant rate, 19.4%, and the highest receiving in-center hemodialysis rate, which was 71%. However, Native Hawaiian and other Pacific Islanders and Black patients had kidney transplant rates that were nearly as low and receiving in-center hemodialysis rates that were almost as high as those of Native American patients. In 2021, the USRDS also reported that there were 25,549 kidney transplants performed. Of these transplants performed, 19,569 of them were from deceased donors, whereas 5,979 of these transplants were from living donors. As per this report, also between 2011 to 2017, the overall number of patients who were added to the kidney transplant wait list was stable and totaled around 24,000 to 26,000 per year. It also reported the following 2 years that the number added per year increased and reached 28,556 in 2019. However, in 2020, that number decreased sharply to 25,136 and then rebounded in 2021 to 27,413. They also reported that by the end of 2021, 72,864 patients with ESRD were on the wait list. That was a decrease of 17.9% from a high of 88,714 in 2014. It was also noted that 40% of these patients had an inactive status, and the COVID-19 pandemic appeared to be associated with the decrease in active and total listings, as well as an increase in inactive listings. The percentage of prevalent patients receiving dialysis who are on the wait list for a kidney transplant also decreased in relative terms by 31% from 2014 to 2021. In 2021, only 12.3% of these patients were waitlisted, which was down from a peak of 17% in 2013. 5 years after waitlisting for a kidney transplant in 2016, nearly half, about 46.3% of these patients had received a transplant, whereas 18.5% of these patients had died. 1 year after initial kidney transplant listing, 12.3% of these patients had received a living donor transplant, 15.2% had received a deceased donor transplant, 1.7% had died, 3.6% had been removed from that wait list, and 67.2% were still waitlisted and receiving hemodialysis. The adjusted one-year graft survival among living donor recipients reached an all-time high of 98.2% for those who were transplanted in 2018. Before that number sharply decreased to 97.8% for those who were transplanted in 2020. The survival rate among deceased donor transplant recipients reached an all-time high in adjusted one-year graft survival for those who were transplanted in 2017, which was 94%, but fell to 92.3% for those transplanted in 2020. So what are the benefits of kidney transplant? Kidney transplant improves not only the patient's lifespan, but can also improve their quality of life. Patients who receive a kidney transplant from a living donor, they're able to live longer lives, they're able to enjoy a dialysis-free life, they're now able to freely travel, fewer restrictions on what patients can eat and drink, more energy to work and travel, and improved sex life and fertility. Deceased donor renal transplant versus living donor-related transplant. DDRTs comprise the larger portion of transplants that are done. DDRTs generally have worse allograft function. Slow initial graft function has been correlated with an increased risk of acute rejection, higher incidence of long-term graft loss, as well as worse patient survival. DDRTs generally have a higher rate of complications and a longer hospital stay during that post-transplant period. According to the USRDS, LDRT is often seen as the best therapy for ESRD patients, as it is associated with a significantly better prognosis than deceased donor kidney transplant or dialysis. LDRT is the preferred choice for multiple reasons. The transplants are always timelier, a reduction of dialysis time, higher rates of immediate kidney function, as well as an improved graft survival when compared to deceased donor. Despite the above-mentioned benefits, LDRT is rarer than DDRT. So what are some of these barriers to LDRT? Lack of knowledge, attitudes, as well as education towards kidney donation, and lack of awareness regarding the opportunities for living donation, concerns that donation of a kidney would negatively affect the donor's health, concerns around the risk of surgery, of kidney donation surgery, as well as surgery aftercare, recovery, and pain, medical costs associated with donation, both perceived and actual, a lack of trust in the medical system. On a healthcare systems level, in a study done in Canada by Sandel et al., although providers acknowledged that discussions with their patients was part of their role, half of the participants felt that the discussions were best suited to be done by the transplant team, or felt that the entire multidisciplinary team was engaged in promoting LDRT. A lack of resources and infrastructure to facilitate the discussion, as well as a lack of education, training, and comfort. Helping to remove these barriers. So there have been legislative efforts as well as national level organizations that have worked to assist in living kidney donations. They do this by removing financial disincentives and expanding opportunities to donate. The National Living Donor Assistance Center was established in 2006 by the Health Resources and Service Administration. So what this program does, it removes the costs associated with traveling related to living donation. This was later revised to cover the potential loss of wages as well as dependent care costs, kidney prioritization, and complication protection. The National Kidney Registry, NKR, helps to save and improve the lives of people with kidney failure or those facing failure by increasing the quality, speed, and number of living donor transplants in the world, while protecting and supporting all living kidney donors. The kidney peer donation is a program that's offered via NKR, whereby living donors are swapped so that each recipient receives a compatible transplant. The NKR Shield program provides protection to prospective donors that include cost reimbursement for lost wages, donation-related travel, as well as dependent care expenses, legal support, and complication protection. Microsite, which is another program offered via NKR. What this program does, it provides websites and coaching to patients needing transplants or those who are seeking a living donor. This increases the chance of patients finding a living donor. NKF is another organization that fights to save lives by eliminating preventable kidney diseases, accelerating innovation for the dignity of the patient experience, dismantling structural inequities in kidney care, dialysis, and transplantation. The Living Donor Protection Act, also known as LDPA, this is a legislation introduced by Congress that would prohibit certain insurance carriers from discriminating against and provides protections for living donors. If passed, this act will reduce barriers prohibiting insurance companies from denying coverage and limiting coverage or charging higher premiums to prospective donors. So there have been efforts to expand the NLDAC, which include increasing the total amount allotted by federal funding, increasing the poverty rate for eligibility, as well as removing the recipient finances for determining eligibility, as well as increasing opportunities to provide education, enlightening the public through videos, real-life stories, as well as the use of social media. Although living kidney donation is promoted as the best treatment option available for people living with kidney failure, individual attitudes towards living kidney donation are subject to change and are affected by legislation, scientific innovation, media campaigns, and one's own experiences. What is the current state of LDRT? So minority groups experience disproportionately high rates of ESRD and are less likely to receive LDRTs. The knowledge deficit, concerns, and attitudes about illness contribute to increased difficulties in identifying and approaching potential living donors. Potential African American recipients may experience higher rate of psychological denial about the need for a kidney, lower rates of LDRT education and transplant referrals for African Americans, therefore lower rates of preemptive physician-patient and physician-family discussions about LDRT. Suboptimal quality of educational information, as well as a lack of decision support regarding ESRD treatment options. Concerns that donating a kidney would negatively affect their health, a general aversion to any kind of surgery, having concerns about needing to change current lifestyle behaviors, or having concerns about pain, recovery, and future illness. Closing this gap. How do we close this gap? So we close this gap by bringing awareness of opportunities for living kidney donation, as well as organizations that facilitate living kidney donation and kidney peer donation. Identifying barriers and facilitators that affect willingness to donate, providing living kidney donation-related knowledge, preemptive transplant education, improved understanding of minority barriers to completing LDRT evaluation and workup, home, community, and clinic-based education. So how is Downstate closing this gap? Our purpose is to increase access to LDRTs for patients referred to our center. So what we do, we teach them to identify potential living donors in their lives via donor map. In completing this donor map, they're able to identify everyone in their lives with whom they're able to share their story with. We teach them also to create a story highlighting their journey with kidney disease and sharing that story with others, as well as educating themselves on living donation enough that they're able to answer questions that may arise. All patients are also provided with personal business cards which identify them as needing a kidney transplant. The business card contains the telephone number to reach the living donor coordinator, who is able to provide more information. This is an example of our living donor map, and we teach them to complete it by starting with the family members that are closest. Oh, I'm sorry. Yes, we teach them to complete it by starting with the immediate family members who reside in the household, then the extended family, friends, co-workers, places of worship, as well as other social networks. And what we have next are the personalized business cards, which we provide to our patients, and it clearly states, I am looking for a living kidney donor for life-saving kidney transplant. If you or anyone you know is interested in learning more about living kidney donation, please call. So at Downstate, we are closing this gap one patient at a time through education. Each one, meet one, teach one. Here at Downstate, it's the best place to get care and the best place to give care. Here at Downstate, because we care. Thank you. Any questions?